Hey y'all, I'm pumped to talk about all things perineal tissue that you need to know before going into your labor and delivery experience. We're going to be covering the important anatomy that you should know about, some of the terms that you might hear your doctor or your provider referring to so that you know exactly what they mean and exactly what they're talking about. We're going to go super into depth on preparing that perineal tissue for birth with step-by-step on perineal massage, the same way I teach it to patients in the clinic. And make sure to stay till the end because we're also going to be covering healing for those tissues postpartum, how to support your healing, and also what a rehab plan for those tissues postpartum might look like. My name's Amanda. I'm a doctor of physical therapy and a pelvic floor physical therapist who specializes in all things pregnancy and postpartum. I work one-on-one with women preparing for labor and delivery and rehabbing from labor and delivery postpartum. And I also work with women in a group setting or with couples in a group setting preparing for their labor and delivery experience. And so everything I'm sharing with you today is what I have used to help real people in the clinic and through my workshops to prepare this tissue for labor and delivery and to help them recover it well postpartum. Okay, let's talk about anatomy first. So when we talk about perineal tissue, what we're really referring to is your perineal body. And that perineal body is what lies between your vaginal opening and your rectal opening in the back. It's this, get it closer. It's this piece of tissue or this part of your tissue here and this muscle. And this is what people are typically referring to when they're worried about tearing or when they're saying that they tore during childbirth. It's a tear that occurs in this area here. This is muscle tissue. If you look closely, we do have superficial muscle tissue here. One of the reasons that women tend to tear in this area versus other areas of the pelvic floor is because a lot of tension is held in that area. All of the connective tissue of your pelvic floor and some of your pelvic organs kind of come together right at that point, at that perineal body. And because it holds so much tension, it can be really hard for it to also let go and stretch and open during childbirth, which is where we get tearing if baby still needs to pass through, but that tissue is just not relaxing and not stretching and opening as much as it needs to for baby to come out. So let's talk about tearing because this is one of the biggest concerns that I hear for women, especially during pelvic floor PT, even in the workshops that I do with couples. I hear all the time, Dr. Amanda, I'm so scared of tearing. The biggest thing I'm worried about is tearing. It causes a lot of anxiety. And so I just want to share with you, if you're somebody who has that heightened anxiety about, oh my gosh, the biggest thing that I'm worried about for labor and my delivery is tearing, that sounds awful. I want to share with you that in that same group of women who have that heightened anxiety that they share with me pre-labor and delivery, when I see them afterwards for that first visit of physical therapy after they deliver their baby, one of the first things I ask everybody to do is to just relay their birth story to me. I want to know about everything that happened, any complications that we faced, how labor went, how delivery went, positions, all the things, and they will recount the entire thing to me, and then I'll wait for them and they're completely done, and then I'll say, okay, did any tearing happen? Did we have any injury? And they'll be like, oh yeah, I had like a 2nd-degree tear. Oh yeah, they said I tore a little bit, but they didn't really tell me how much. So my point with sharing that with you is that even in the women that are so highly anxious about it, and it does happen during childbirth, it ends up being such a non-event in their mind compared to everything else, compared to bringing their baby in the world. And even when I'm seeing them 2 or 3 weeks postpartum and that tearing and that tissue is still very much in its healing state, and maybe there's still some stitches left or some repair left that's still healing, it's just not the thing that's at the forefront of their mind. And so when you build it up in your head so much beforehand, I just want to tell you that it ends up truly not being as big of a thing as you're worried about. And so I hope that that helps to relieve some anxiety around this topic and around what might or could happen to this tissue during labor and delivery. So let's talk about tearing and what the degrees of tearing mean and look like. So when we have tearing, it is graded between a 1st, 2nd, 3rd, or 4th degree tear. And a 1st degree refers to tearing that only happens in this opening tissue of your vaginal canal. So it's the opening of the vaginal canal, which is the internal tube, right, that baby is passing through to exit your body, and then this tissue here. So it's not really into muscle tissue yet. If we just have a 1st degree tear, it's a little bitty tear. You might have 1, maybe 2. Sometimes they don't even stitch it at all if it's a small enough 1st degree tear. And so that's the smallest degree of tear that we can have. A 2nd degree tear means that it's getting into this muscle tissue or into this perineal body either a little bit or a lot. There can be a wide range in my experience of what a second degree tear might be, which is where maybe you pay a little bit more attention to how many stitches they say it took to repair it, but it means that it's coming into this muscle tissue. And see how much distance there is in this muscle tissue, which is why even if it's just like a tiny bit into that muscle tissue, it's still counted as a second degree tear, but it means that it can go all the way to like the middle of that muscle tissue. A third degree tear means that it's coming up to the muscle of your external anal sphincter here. It's coming up to, but not through, that external anal sphincter. A fourth degree tear means that it goes all the way through, and it goes through that muscle tissue as well. So there's some stuff that we have to consider rehabbing in the back of your pelvic floor, in the back of those external tissues as well. So something to consider is that there are things that your team can do during your labor, especially during your delivery while you're pushing, that may help to decrease your chances of tearing or your degree of tearing. Some of those things are perineal stretching or perineal massage that your provider can apply while you're pushing your baby out or while baby is crowning to help that tissue open up. We can apply warm compresses to that outside tissue so that the tissue feels a little bit more warmed up, and it might increase its ability to stretch and open up as baby passes through. Some of the labor, or especially delivery positions, so the position that you're in while you deliver your baby, is thought to decrease chances of tearing because it gives your body a greater chance of opening up on the bottom side of this pelvis as a whole, so that maybe we don't have to tear in order to make room for baby to exit your pelvis. And then there are things like assisted delivery, so forceps, vacuum, or episiotomies that the doctor may say he or she needs to do to assist baby to exit your pelvis. All of those are decisions that you can talk with your team about ahead of time, and especially make sure people in the team that's there on the day of is aware of your preferences for your opinions on like pros or cons of any of those options. And so I just wanted to direct you to a link that's in the description of this video. That link is to my Birth Wishes worksheet, and a section of that worksheet goes through all of those different options of things that you may want or not want your team to do during delivery, especially as it pertains to assisting this tissue as baby is passing through. It just gives you something to work through and a way to communicate those options with your birth team ahead of time and even on the day of. So if you want access to that free resource, it's in the link that's in the description of this video. But now let's talk perineal massage. So lots of people look into perineal massage, perineal stretching for preparing this tissue for labor and delivery. It's something that I teach to all of my pelvic floor patients whenever they're preparing for labor and delivery, and I also teach it very in depth in my labor and delivery workshops that I take couples through. Here's the deal with it. The research is kind of mixed on if it's going to prevent or decrease the chances of tearing. And so some providers might say, oh, you can just ignore it. We don't have evidence to support that it's helpful. But we think that it might be helpful, and we know that it isn't harmful. And so it's one of the things that I do teach patients, but here's the context that I teach it within. I don't believe that we are physically, mechanically stretching and lengthening tissue and adding its ability to stretch. We're not adding length or stretch to the tissue in a way that is gonna like sustain and be there ready for us to use during delivery. What I think the benefit is and what the goal is of perineal massage or perineal stretching is that we are training your brain and your nervous system and the tissues to get used to that stretch sensation, so that when you feel it during labor and delivery as baby's head is crowning, it's not a new sensation to your system. Because if it does that, its natural reaction is going to be to tighten this tissue up and to guard against it. And if we're tightening the tissue and if it's going into a guarded state because of that stretch sensation, then it's doing the exact opposite of what we want it to do as baby is passing through. One, to make baby's exit out into the world smoother and easier, but also because that's what theoretically can lead to tearing, is the fact that the tissue didn't stretch and allow a stretch to happen. So when we're working this tissue prenatally and talking about stretching and perineal massage, what we're really doing is training our body, training our system and the tissues in our brain to feel a stretch and say, that's good, that's normal, I don't have to be worried about that, I felt it before. And we're training ourselves to stay relaxed into it and allow it to happen and trust it to happen, so that we can take that skill into labor and delivery and know what it feels like when that tissue stretches, and use that as a way to keep ourselves calm and keep ourselves relaxed into the sensations that you're feeling in your body as baby exits your pelvis. So that is truly what the goal is when I teach perineal massage and perineal stretching and preparation, is to train that acceptance and that trust of the stretch sensation, so that we limit our chances of trying to guard against it or tighten up against it when we're actually delivering baby. So when we talk perineal massage, we can do this on our own body, or you can have your partner assist you. In my experience, most moms find it very difficult and very uncomfortable in that third trimester to be able to reach this tissue themselves, and then it's really hard for them to be able to relax and let it happen. So it almost makes it more uncomfortable to stretch down here because they're straining to reach it in the first place, so then they can't relax, and it's this whole thing. Some of my patients are like, that's weird, I don't want my partner down there, I don't want my partner doing that, and then that makes it really hard for them to relax, and that makes it really hard for them to do this efficiently and really reach the goal that we're trying, which is relaxing into it and not guarding against it. And so whichever one of those is more correct for you, that's what we're going to go with. There's no greater benefit to you doing it versus your partner doing it. It's whichever one that you feel like you can relax into and allow the stretch to happen. If you are working on this tissue yourself, a really great place to do it is in your shower. If you have a seat in your shower or a ledge that you can sit on, where you can sit your sit bones on it, but really scooch this perineal tissue off of the edge of it, then you're sitting and you can more easily reach down to do it. If you're laying back, like laying in bed or laying in a bath, it's going to be really difficult to reach your fingers to do this massage here. So sitting up and sitting with that tissue off of a ledge, or on a toilet. Make sure the toilet is clean. Obviously, we're washing our hands beforehand anyways, all of those things. But if you're sitting on a toilet, there's already an opening to this tissue that you can reach, and there's room for your hands to drop down in that area to do it. However, if your partner is assisting you, then laying back in bed, that's where most of my patients do it, laying back and getting comfy so that your partner can work that tissue, that is where it works really, really well. So that's the setup for it. We're always making sure, again, like I said, that we're washing hands, using gentle, fragrance-free soap is most ideal if our fingers are going to be in this area. Nails are clipped, nails are filed. I know this all sounds silly, but it's stuff that people forget about whenever I teach them, so I've learned to just say it just in case. And then also we're using a little bit of lube. So whatever lube you already know works well for you and that works well for your body, using lube to help make this more comfortable. And then once we're in there, all we're doing is applying a little bit of a stretch straight down. So if you're doing it, if you're doing it on yourself, you're going to be using your thumbs. If your partner is doing it, they're going to be using index finger most likely. And what I like to point out is that the goal of perineal massage is that we're getting to this first layer only. So see how I can take this and detach it, and we're just getting to this first layer. Goal of perineal massage isn't to get to this deep pelvic floor. That's what your pelvic floor therapist should be working on. So we don't need to get to these deep muscles. That can feel really intimidating for couples if they think that they have to go there. We're really just aiming for this superficial tissue to make sure it knows how to stretch and open. So with that, whenever I'm doing perineal massage on a patient, it is just up to my first knuckle, like this little bitty part of my finger up to my first knuckle. That's as deep as we need to be into the vaginal opening in order to get the tissue that we're aiming for this perineal massage. Once you start that, I guess I can put her back on her body. Once you start that, we might be using 2 fingers. The goal is eventually to use 2 fingers, but you can just start with 1. We're gonna pull straight down towards sit bone first. So we're just stretching straight into the middle of that perineal body. You might stop, breathe into it, make sure that you're not fighting it, and then once you give your partner the go ahead, if your partner is helping you, and say, okay, I feel relaxed into that doesn't feel uncomfortable, then they can stretch a little bit more. Once we feel like we've stretched pretty well down straight into the middle and we're not having to work so hard to stay relaxed and to not fight against it, then we can start also stretching out to the side. So I like to tell people we're stretching, ideally, if we're just using 1 finger, we're stretching in a half U shape. So we're holding that stretch down to the middle, and then we're also pulling out and stretching towards the sit bones. And then we're just going little by little with your partner giving you the go ahead, saying, okay, I feel relaxed into that. We can add a little more stretch. Okay, you can go a little bit further out to the side now. Once we get to a point where it's comfy, we can have both fingers inserted and we can be stretching down the middle and then out to both sides. And so then we have that full U-shaped stretch going. I'm really exaggerating it here. I'm exaggerating it so you can see it. But what I want you to realize is that this tissue is not going to stretch that much right now. And it really isn't supposed to, which is why I say the goal isn't a whole amount of stretch that we want to add to these tissues. There's not this like, I need to stretch it big enough for a baby to come out right now. You're not going to get there. We have an entire hormone cascade that takes over during labor and delivery that you're not going to get when you're prepping this perineal tissue prenatally. And so just know that it's not about the degree of stretch, it's how well you are relaxing and training yourself to just accept the stretch. And if it's uncomfortable, then we're desensitizing those tissues so that we can get it less and less uncomfortable, so that it's less and less something that your body wants to guard against. I like to tell couples we're not spending more than 5 minutes here. This is delicate tissue. This is tissue that might not love to be stretched, especially right now when it's under all of that tension from a growing baby and a growing uterus. And so 3 minutes is great if it's something that you were like, yeah, that felt really easy. I didn't feel like I had to work that hard to stay relaxed into. Great. If you hit that like full U-shaped stretch and we're working the tissue and we're 3 minutes in and it feels easy, then call it. If you had to stop a little bit more along the way and breathe into it, then 5 minutes is plenty. I don't like having people do it more than 5 minutes because then it just feels like the tissue gets overworked, or maybe we create some more sensitivity in there that we need. But that's plenty of time. Once we hit that mark, we're done. You're not going to worry about it until the next day when you work on it again. We are shooting for as close to daily as you and your partner can get, but a few times a week is awesome. The standard recommendation is starting at 35 weeks. I start women way earlier than that. I start them somewhere in the beginning of that third trimester because 37 weeks is full term. We don't know when that baby is going to come. 2, if there's tightness and sensitivity in there and it takes us a long time, then we want to address that early so that we have enough time to decrease the sensitivity gently and gradually, and we're not like in a rush against the clock. So starting somewhere in the beginning of that third trimester is a great starting point. But if you're already past that point, it's never too late to start. So start on it. If you're watching this video and you're like, I'm going to be 37 weeks next week, that's okay. Start on it now. I have women start with me in pelvic floor PT for the first time around that time, or come to our workshops for the first time around that time, and they can still make great strides in that perineal desensitization and training the tissue with as little time as they have left. Let's talk about supporting these tissues for good healing postpartum, all the things that we want to consider. The biggest thing that I want you to take away from this is that our bodies want to heal. So all of this applies whether we had no tearing. I want you to realize that there was still a really big stretch applied to that tissue and your body is still healing, especially your pelvic floor is still healing. Or if we had a small degree or a large degree, no matter what, there's still healing taking place at these tissues. But I want to give you the confidence that your body wants to heal, and it has very specific mechanisms to come in and heal tissue damage. Our job, especially in that first 6 weeks postpartum, is to just not get in the way of that. So we don't necessarily need to feel like there's all this stuff that we need to do to heal the tissue, especially if there was a tear, but we do want to make sure that we're doing things that support healing by not getting in the way of our body's natural healing mechanism. So some of the things that I teach to help support that, one thing is around toileting. So immediately postpartum, you probably are not, no matter what, even if there was no tear, you're probably not going to be wanting you to use toilet paper or anything with friction against that area after you eliminate, which is where a peri bottle comes in. So the peri bottle that I recommend, if you look at the links in the description here, there's a link to my Amazon storefront of my postpartum recommendations, and the peri bottle that I recommend is linked in that storefront. But the peri bottle is going to be something that you want to make sure that you already have ready at home before you go off for labor and delivery, so that it's there waiting for you to use when you get home, because you're going to need it right away. So a peri bottle is just a way that you can rinse that area after toileting so that you're not having to wipe anything down there, which can really disrupt the healing of those superficial tissues. And if there are any stitches down there, you're especially not going to want to be wiping. So that peri bottle is great to make sure that you already have it home waiting on you. After the first few weeks, after the first couple 2 to 3 weeks, a lot of my patients find that they're ready to start wiping down there, but we don't necessarily want the roughness that comes with toilet paper and that much friction. So that's where having some water wipes on hand, just typical water wipes. They can also be the same baby wipes that you're using for your baby, as long as they're fragrance free and don't have any crazy stuff in them because we might have an open wound down there still, and it's just like stuff that we don't want to around our vaginal canal as a rule of thumb anyways. But that's why I find water wipes work really, really well. So again, having those on hand for yourself so that you can still feel like you're cleaning down there really well, but it's not the friction that comes with toilet paper. When you do use toilet paper, you're patting to dry, all of those good rules of thumb. That all is just a way of making sure that we don't disrupt healing or get in the way of healing of that superficial tissue. The other way that we can really get in the way of healing for those tissues down there and for the rest of our pelvic floor is by dumping too much pressure down there unnecessarily. So when I say pressure, I want you to think of coughing and sneezing are big ways that we increase pressure to those areas, but we can't do anything about that if we have to cough or sneeze. But when we hold our breath and do something with effort, so postpartum, I like to remind women that effort could look like standing up from sitting down, getting up out of your bed, sitting down in a chair, going up a set of stairs. All of those things, even though they might not feel like effort to your body, they actually might feel like effort to your body, but even if they don't, they are effort or heightened effort to your healing tissues. And if we're doing those activities and holding our breath when we do them, then we're increasing the amount of pressure that we're pushing down into our healing tissues. And if we're doing that over and over and over again throughout the day, then we can really limit how much our body can heal, especially in those early weeks postpartum. So just making sure that you remember to exhale with effort. Exhale as you get up out of a chair. Exhale as you sit up from laying in bed. Exhale as you pick your baby up from the bassinet. Things like that can really help to give that pressure an escape hatch so that as we exhale, we're actually supporting our tissues and emptying that pressure in a different direction instead of emptying them down into our healing tissues, into our healing pelvic floor, and possibly a healing perineum. Lastly, when it comes to healing, I just want to encourage you to look at the tissue, which is hard to talk a lot of women into, but taking a mirror of any kind that you can use to put between your legs and really look at the tissue and get eyes on the tissue. The reason I say this is because I want you to look at it when you get home, but then I want you every 2 or 3 days to look at the tissue so that you can see how it's changing and make sure it looks like it's changing in the right direction. So if you start to see like it really looks like it's changing for the worse, or it's getting more red, or it's looking like more opened instead of less opened. That's the easiest way I can explain that. But the problem that many women face if something goes wrong with healing down there is that when they start to feel like something isn't right down there, they don't know what it looked like beforehand, so they have no frame of reference. If they do at that time take a mirror to see what's going on, no matter what, it's not going to look like what you're used to seeing. And so then if you have no frame of reference to be like, I don't know if that looks bad for the stage of healing that it's at. And so if we don't look ahead of time, then we have nothing to compare it to. So look at the tissues when you get home. Make it a habit to look every 2 or 3 days. And if something starts to just look like intuitively that looks like healing wise it's going in the wrong direction, then you can call your doctor, ask for an earlier visit, and just go get it checked out. Even if it ends up being nothing, I would rather you and they would rather you go in and get it checked out ahead of time so that maybe you can catch something before it becomes a really big deal. Catch it when it's just a little bit of a big deal so that they can address it then instead of waiting until you feel it and you really can tell something's wrong. So the only way you can do that is if you're looking at the tissue on a regular basis. And last but not least is what rehab looks like for the perineal tissue, especially if there was any tearing. The first thing that's important to know when it comes to that is that everybody talks about scar tissue, and I think that scar tissue has gotten a really bad rap when it comes to people just think that scar tissue is the worst thing. But if we had tearing or we had damage, then scar tissue is what our body is equipped to heal that damage with. So scar tissue is not bad. We want scar tissue down there, especially if there was tearing, especially if there was damage. So scar tissue is actually a really good thing, and that's why we're limiting activity in those first 6 weeks because we want to give our body a chance to build that scar tissue and repair the tissue. Then after those 6 weeks, once we know that that scar tissue is formed where we need it to form, repaired what we needed it to repair, then our job is to come in and make sure that that scar tissue moves and stretches the same way that your normal tissue around it does, so that it doesn't feel like such a foreign thing to your body and to what you can sense going on down there. So scar tissue in itself is not bad. Immobile, stiff stuck scar tissue, that's where we get problems. And so, postpartum, the number one goal, or the very first step goal in treating those tissues, especially treating them hands-on and manually, is to make sure that that scar tissue just starts to learn to stretch and flex and move the same way that all of the rest of the tissue down here moves, so that everything just feels like one solid movement, moving together and working together. So that's the number one goal with scar tissue. When we get that all clear at 6 weeks to start to work on the scar tissue, that's what the goal is. We aren't breaking up scar tissue. We aren't getting rid of scar tissue or eliminating scar tissue. The scar tissue is supposed to stay there. The scar tissue is like the repair patch. We want it there. We just now need to make it mobile. That's the goal. And then the muscle coordination piece is making sure that anywhere that there was damage to the tissue, anywhere that there was excessive stretching or tearing or damage of any kind, that all of that tissue starts to work together as a unit with the rest of the pelvic floor, with your pressure management system, your breathing, your hip stabilization system. We just start to re-coordinate in that tissue, making sure that it doesn't get left behind because of the damage. We make sure that our brain reconnects with it and starts using it again, just like the rest of the pelvic floor and with the rest of the team. So that's like a super broad overview what rehab goals are post, especially if there's any damage to your perineal tissue. But all that goes to say that it's all rehabable. No matter the degree of tear, if there was no tear, just some stretching, whatever it was, the goal remains the same. And it's, can the scar tissue move? Now that it can move, can it work together with the rest of the team? Great. Now it's like it never happened in the first place. And that is what rehab looks like for that perineal tissue. Okay, that was a lot. I think this is going to end up being a longer video than normal, but I wanted to really pack the information in there because this is a source, like I said in the beginning, a source of so much anxiety for women going into labor and delivery and going into birth, that I hope that the information just really helps to relieve some of the anxiety and simplify it, take some of the mystery out from it so that it doesn't feel as scary, and so that you realize there's things you can do ahead of time, there's things that we're going to do to support healing, there's rehab for it no matter what, so that you can go into your labor and delivery feeling more confident and hopefully with some of that anxiety taken away. If you want to learn more about this, all of this plus so much more having to do with labor and delivery is what we go into in those labor and delivery workshops that I mentioned. If you're local to Arvada, Colorado, we do one a month in person with up to 6 couples at a time. If you're outside of Arvada or outside of Colorado, then you can jump on the Zoom version of that. We do it live over a month as well. The link to those is going to be in the description below, so you can see any upcoming dates or just see more information about them in general. But all of those participants get access to that Birth Wishes worksheet that I mentioned in the beginning, and you can access that worksheet too, just without having to be a workshop participant. So if you're really just looking for something that is a guidance for you to look up your stuff on your own, then that worksheet is available to you also through the link in the description. So make sure to check that out. I hope that was all super helpful for you, and I will see you next week.